Dr. Linda, I want to thank you for joining us today and congratulations on winning the NACHC 2025 Lifetime Achievement Award. It's a great honor and it's a great honor to chat with you today. I want to talk to you about what got you started. What was your path to bring you to health centers and the movement?
So my path has actually been serendipitous. But also I think in many ways divine. I think I'm exactly where I'm supposed to be. And it certainly hasn't been because of any type of intentional design, but really just arriving and accepting the invitation to serve people and multi-generational families and my hometown community that I care so deeply about. And then finding the organized platform of the National Association of Community Health Centers, which, like our state primary care association and the Pennsylvania Association of Community Health Centers, is just such an amazing, empowering, validating, and supportive network where I've found my tribe, right? Found the movement, learned about the movement. And it's just an incredible honor to be here with you and to be one of the Lifetime Achievement Awards for NACHC.
Tell us about the clinical practices at your health center and how you excel at it.
So our health center proudly is an organized platform for voice of the community, right? Governed by the patients and families we serve. And what we really excel at is whole person health services, primary care health services, integrating behavioral health, dental services, Wright, addiction services, recovery services, services to address chronic diseases, obesity medicine, a little bit of lifestyle medicine, nutrition services. And so I think the most vital and crucial message is that we offer whole person health services, vital health services for everyone in our community across generations. And that we do it not only in the physical facilities of the health centers, but we extend our services into hospital-based teaching health services for our patients and families when they're most vulnerable in acute hospital settings. We round in skilled nursing facilities. We visit our patients in acute rehabilitation facilities. We're deeply immersed in community-based venues like school districts. And we're also the mighty primary care doctors that still do house calls. So we offer whole person health services, deeply immersed in community-based settings. We go where the people are, and we follow multi-generational families from birth to grave.
That's amazing. So you meet patients where they are in extraordinary ways. We know that this nation faces a primary care provider shortage, and your work is dedicated to building that workforce pipeline. Can you tell us a little bit more about that?
So I don't think there is any more awesome career than being a primary care physician in your hometown community where you can proudly serve and take care of multi-generational families. I think the relationships with those families, the relationships with your teammates who help you to care for them, and, the investments that you make in the community where you can feel the impact of your professional investment and who you are and what you contribute is absolutely awesome. So I personally think that if we can get the primary care value equation story out there and for the young up and coming workforce in a way for them where they can really deeply understand the power and the human connection and the relational value that's returned to you. I can't imagine that anybody would want to be anything more than on a primary care team. I think that when it comes to workforce, primary care in our country is over-responsibilied and under-resourced. And so it's very challenging to be a champion for community health, to be a fierce advocate for patients and families. That's required to be a really exceptional primary care service provider. And I think as we live that reality, it's a challenging reality because as the workforce comes into community health centers through pipeline programs, they see the challenges of that trauma platform where you have little resources to take on great, tremendous responsibilities. I think it can be daunting. I think it can be intimidating. And I think that one of the most important things that we do organizing through platforms with NAC is that we can change that narrative to be less daunting and more empowering and more supportive as we embrace the future workforce in systems that are going to look a lot different 5 years from now, 10 years from now, 15 years from now, as we embrace teamwork, as we embrace artificial intelligence and information technology and interoperability. All of that can be used to make primary care more manageable. And I think as we get our arms around it being more manageable, we'll be able to better tell the story of its power. Because I personally think that strong primary care platforms that are organized through amazing high integrity organizations like NAC can solve our primary care and our overall healthcare crisis in our country, making it higher quality, more accessible, more human-centered, putting patients in front of profits, and more affordable.
And you've really dedicated your work to training more providers through medical education and at the Wright Center. Can you tell us a little bit more about that?
So I'm a first-generation physician, proud to be a first-generation primary care physician. I come from a family of public health educators. I am second generation away from immigrants to this country. So my grandfather was called the Galliano man. He raised chickens. And in addition to that, he raised homing pigeons. And I think he put one in me, which is how I kind of went on my little journey to become a primary care doctor, watching a lot of Marcus Welby in the 70s and 80s. And, went through very significant public health training down in the Texas Medical Center, at Baylor College of Medicine, and then up to the Mass General system in Boston. And it's very interesting because on that very aggressive academic career path, I actually didn't realize until decades later when I got more deeply involved in the health center movement and in the development of teaching health centers that I trained in primary health centers in Massachusetts at the Revere Health Center and also at the Chelsea Health Center. And so it's funny because I hear the discussions in the NAC environment frequently about people who train in health centers tend to stay and serve in health centers. It wasn't until years after I had led the designation of the Wright Center as a federally qualified health center lookalike and a decade after I was involved in the teaching health center movement that I recognized, wow, I'm a product of health centers. But the way that I was introduced was really through workforce development and just a firm belief that the reason that we generate workforce is to serve the people. And that if you care really deeply about the community that you're serving, it has to be in your DNA to generate workforce development. So when I first came back from Boston after my residency training, I came back to join my primary care physician who delivered me and took care of 4 generations of my family and made house calls to my grandmother for congestive heart failure in the middle of snowstorms in northeastern Pennsylvania. And, I looked at his legacy, which was what a single man can accomplish in, 40 years of a career. And I started to embrace on a similar career path, but was fortunate enough to get an outreach from the Wright Center to come and join us. The Wright Center was started in 1976 through a Bureau of Manpower Workforce grant by the Health Resource Service Agency. So it's funny how history repeats itself. I got an outreach to be part of this small engine that was generating primary care workforce. And I said, well, geez, that would allow me to systematize what that mentor-tucker clause had been for our community for 40 years. And so I wouldn't need to worry about succession planning because we'd grow our own future. And so I got involved with the Wright Center. And, the Wright Center has a dual mission. And the mission of the Wright Center is to improve the health and welfare of our communities through responsive, whole person health services for all, with integrated, sustainable development of a workforce that's competent and privileged to serve. Probably wordsmithed a little bit there, but, I believe that workforce development is a responsibility of strong primary health service systems to ensure that patients and families can rely on the infrastructure that you've developed to take care of their future generations in a community. And I think the real power is to recognize that educating the future workforce is a privilege, but it's also a public right to be involved in that. And that the governance of health centers is honestly collective genius offered to us through the HRSA compliance manual, get the patients and families to not only own their fiduciary rights and responsibilities to oversee health services, but also healthcare workforce development. And so I can't imagine not being involved in workforce development. I can't imagine not empowering communities to organize their voice, bring all their stakeholders together, and look deep through a strengths asset map at what is our educational capacity to make our own, right? Nothing is more powerful as a physician when you look in the eyes of a child you're serving from a multi-generational family that you love and appreciate, and seeing the eyes of a future nurse, the eyes of a future physician assistant, the eyes of a future medical assistant, the eyes of a future doctor. It's extremely validating. It's really inspiring. And to know that you are in that sacred space with a child who otherwise might not have that opportunity. Very, very powerful. And I feel one of the reasons I love my job so much. And, to take that responsibility and that opportunity that you've afforded that child and then carry that with you into an executive room where you can share decision-making authority with other like-minded people to design the systems to serve that family, to serve that child, not only through health services, but through opportunities to access careers with economic mobility, right? Amazing.
I love how you referred to it earlier as the teaching health center movement, because I think that's a great way to refer to it. It's very inspiring. I want to get to what makes, in your opinion, health centers so valuable in their community.
I think health centers are invaluable in their community. And I think that they are, by design, the highest integrity nonprofit organizing platforms to give voice to the people. And that voice over, stewardship of not only primary health services, but also future healthcare workforce development is a crucial asset. It's probably never been more important than now with everything that's going on with the commoditization and the commercialization and the corporatization of healthcare. So what do I think about community health centers and the significance of their role in communities? I think they're American jewels. I think they're the platforms to organize communities in ways that can empower the voice of the people. And I personally think that from a governance standpoint, they're wired right. And that just gives me a lot of hope about the future. They're going to be a moral compass for how we get to a better situation in American healthcare and workforce development.
That's very inspiring. Dr. Linda, I really appreciate you joining us today and sharing some of this wisdom and inspiration, and congratulations for being the 2025 winner of the Lifetime Achievement Award.
I'm grateful to you, Amy, and I'm grateful to the National Association of Community Health Centers and its governing boards and its steering committee, and just all that it's done to ensure that I've had an incredibly fulfilling career. It's the National Association of Community Health Centers is my tribe, right? I'm all about it. Die-hard primary care, die-hard health center movement, and die-hard public health enthusiast for this country.